Good afternoon and welcome to Joy Newsroom. Sorry for the delay. We had some technical challenges, but we're on air now. Coming up in this bulletin, Western Regional Police Command raid illegal mining enclave at Ajomoro-Gwira district, seize excavators and arrest 15 miners. Also, a devastating rainstorm swept through Bankaba and neighboring areas in Pandai district of the northern region, leaving 100 houses and a school destroyed. These and many more stories coming up in the next 1 hour. Stay with me for details. In our very first story, the Western Regional Police Command has raided an illegal mining enclave in Avelobo and Angango in the Ajomoro-Gwira district of the Western region. The team seized 10 excavators and arrested 7 foreign nationals and 8 Ghanaian miners. The illegal miners have taken over the Ajomoro enclave, mining illegally and polluting the Ankobra. Authorities say the excavators and others seized equipment will be used as evidence to prosecute them. Our man on the ground, environmental journalist Erastus Asari-Donko, joins me via phone for more details on this. Erastus, thank you for joining us. Do we know how long this has been going on for?
Yes, it has been going on for months. In fact, when the report got to the team and they decided to step in. And so if you look at the area that has been covered, this is in the Nzema East district, and you have those who are mining close to the Ankobra River and its surrounding areas. So in areas like Abelebo and Akango, those are the areas that were targeted. So you look at the devastation and you look at the pollution that they are doing, the activities is spreading towards the Ankobra River. That is what motivated the personnel to take this action.
Excavators been seized in the past that went missing. And you've been on the ground following all these illegal mining activities. How differently are they treating these seizures? And how confident are you that this time it will be indeed used as evidence to prosecute illegal miners?
Well, I have the same conviction. The past is also guiding us into the future. I've been asking the same questions. And I'm told by the Minister for Lands that this time around they are keeping the excavators per the President's orders, and they are going to use these excavators and the suspects to aid in prosecutions going forward. So as I speak with you, I'm briefed that the 10 excavators that were seized are being carted out of the site to a located designated area to be used for prosecutions in the future. The 7 nationals, mostly Chinese nationals and Indians, have also been placed in custody. 8 Ghanaians as well, all pending prosecution.
Bringing us those updates on that illegal mining. Remember, hashtag no to Galamsey is still on. Hashtag stop Galamsey now is still on. Meanwhile, President John Dramani Mahama has instructed the team tackling illegal mining, the Galamsey menace, to seize excavators instead of burning them. And speaking after members of the Christian Council visited him at the Jubilee House, he said illegal miners have been flushed out from the Tano in Nimre Forest, with the operation targeting other affected areas, other forest reserves. And he added that a mobile team is on standby to ensure illegal miners do not return to the forest.
Show Ghanaians what the real state of the nation is. And I believe that we must bring honesty in leadership and tell Ghanaians what the real situation is. I think that if Ghanaians understand what the situation is, they are willing to make the sacrifices to make things better for everybody. With regards to the issues you raised, Galamsey is a major headache for all of us. It's estimated that currently about 1.8 million of our compatriots are involved in small-scale mining. And that creates a big issue with regards to issues of employment and displacement, you know, from small-scale mining. Small-scale mining is legal, and our laws recognize it, but it must be done in a responsible and sustainable manner. We have about 280 forest reserves in this country, and the ones that are affected are about 43. And so we did one operation in the Tano-Nimiri forest reserves, and we've gotten the excavators and things out. And so they're going to target another one, the worst ones, and then we'll take them one by one and get the people out. I've told them not to burn the excavators, they should confiscate them. We'll also have a mobile team so that in case they try to incurse again and the forestry people cannot handle, they'll call the mobile team to run in and go and give them reinforcement.
In other stories, a devastating rainstorm swept through the Bankamba community and neighboring areas, including Bigamambo, Chokori, and Kumbi in the Kwandai district of the northern region on Friday night. The storm destroyed over 100 houses and a school, leaving a trail of destruction. Several electricity poles were pulled down, plunging the area into darkness. Now, roofs were ripped off and homes were severely damaged. Most farmers whose crops, including maize, groundnuts, soybeans, and beans, were destroyed, and the area, which is predominantly made of farming communities, suffered heavy losses last year due to the drought and had little to survive on until the harvest season. However, they have now lost everything, and the people said they've been left with nothing to feed on.
And so we are to family. Yes, I'm by say, Mebua NGOs will be our way to supporting. On best support now amount for intimate roof on die. Because Mimu, a damn bonus, I am being I have for my damn music up on the phone. Yes, sir, I must say, on Mebua Bankamba, Codiana, and I'm now on more than I say, and now, Montenegro.
I'm crying. NGOs aban se omumbe tired na asitina mu sese de ayede na we de ni se nyankopɔ na ye yemfa kase bibi na asi enya edan ba ko enya mienu edan edikɔ wɔ ha nti yehia aboa ne ankronkron ne NGOs mwa ommeye ado.
Now, the assemblyman for Bankamba, Kenneth Kwame Ndingam, joins us via Zoom for updates on the situation. Kenneth, thank you so much for joining us. Tell us how the affected residents, mostly farmers, are coping after that devastating rainstorm. But first, has electricity been restored to the area?
Yes, please. Yeah, it has been restored.
And how are the farmers and residents coping?
For farmers and residents, actually, if you happen to be at the scene, you realize that the people of Bankamba have been rendered hopeless. It is homeless because a complete house, just a house that will be completely. Then the house. The landlord will tell me, oh, Mr. Ken, look at what has happened. So what? I say, it's a gradual process. I don't have any power over me, but I'll put everything for our MP and then whatever organization. But I know our they can something small. But for that disaster is too serious. So I'm just urging the benevolent organization that they should chip in and then help the community.
Kenneth, what information have you received from the authorities as of now?
Sorry?
What information do you have, maybe from the Member of Parliament and other authorities so far?
Actually, yesterday they went for some registration. They went and were doing the NADMU. NADMU went to Bankamba and were doing registration. The affected houses. And so for now, I've been communicating with my MP, but for now, it's a private issue.
Kenneth Kwame Ndingam, thank you for joining us. He's Assemblyman for Bankambak area, where that devastating rainstorm swept through the town and destroyed crops and livelihoods. Moving on. The National Executive Council of the Civil and Local Government Staff Association of Ghana, that's CLOSAG, has rejected the Minister of Labour, Jobs and Employment's request to end the ongoing strike. CLOSAG had stayed away from work earlier this week, asking the government to terminate the appointment of Samuel Adumbotri as Births and Deaths Registrar. Stephen Mensah gives us more from a CLOSAG meeting.
Services at the country's ministries and other essential places have halted for days now thanks to a strike by the Civil and Local Government Staff Association of Ghana. CLOSAG is protesting the appointment of Samuel Adumbotri as Registrar of the Births and Deaths Registry, citing political exposure. There have been calls from the general public for CLOSAG to return to work, a plea made stronger by the Employment Minister, Dr. Rashid Pelpo. Executive Secretary of CLOSAG, Isaac Bampo-Addo, has reaffirmed the association's stance to continue the strike until their concerns are addressed by the government. He indicates that the directive from the Minister of Employment and Labour Relations lacks a clear roadmap.
We are not challenging the authority of the President in appointing persons into the civil service and local government service. Article 195 of the Constitution is very clear that persons to be appointed or in acting positions is by the President in accordance with the advice of the Council in consultation with the Public Services Commission. What was read from the Births and Deaths Registration Act was picked from the Constitution, 195 of the Constitution. It was nothing new. But we would have loved if Felix Kwachi should have gone further to tell us that which council gave
Moving on, the Gender Ministry is actively working towards implementing existing laws meant to take children off the street. Highlighting her agenda for the ministry during a media engagement, Sector Minister Agnes Namomolate also noted all 16 regions in the country would have shelters to accommodate abused women while facilitating rapid responses to their issues.
The issues around gender equality, so social protection, you know that the social protection bill is yet to become an act. All of the things that we want to do around or on social protection, there's a need to have the backing of the law, and so that it is grounded, and then it doesn't get treated as a privilege, but it gets treated as a matter of right. And so one of the key things this ministry will be championing is making sure that the social protection bill is passed into law. And then we start working around getting it, social protection bill is passed into law, and then we make sure that it is activated. You know the challenge we have with the many laws we have. Most of them are there, but the implementation becomes an issue or a huge challenge. And so we are going to make sure that we rally around the issues that bothers us. And so as part of the manifesto promise of this administration, we are going to build shelters. It's a promise, 16 shelters in 16 regions. And so very soon you'll see us on the ground cutting sword and ensuring that that is realized. It is one of the key processes to ensure that issues of abuse are rapidly responded to, so that the victims are first protected, and then we look at how to handle or deal with the perpetrators.
Managing Director of the International Action Network on Small Arms, Johnson Asante-Chum, is calling for the urgent need for legal reforms to combat rising crime, as he states that Ghana fights 2025 crimes with 1972 laws. Speaking at the Wansa Ghana evening encounter on the theme Enhancing Advocacy and Lobby Capacity for Reforms in Small Arms and Light Weapons in Ghana, Mr. Chum said despite advancements in technology and the evolving nature of crime, Ghana's laws remain outdated, making it difficult to effectively address modern security threats. In response, the Small Arms Commission has introduced the National Arms Commission Bill, which seeks to empower the Commission to track individuals in possession of firearms and regulate the number of guns a person can own. Here's more.
After 18 years of implementation of the Commission Act and 53 years of the Arms and Ammunition Act, it has become clear that there are gaps and loopholes. Now, how do you use 1962 law to fight a 2025 crime? So we have a law that is as old, but we have criminals who are as sophisticated and technically savvy in 2025. And we think that we will successfully fight that crime. So I'm coming down into why there is the need for a review. I worked at the commission, so I was part of those who worked on the law and those who attempted to implement the law for 13 years or so of my stay there. So I speak from informed position. So we are attempting to fight 2025 crimes with 1972. Let me be general and say 1972 because there was a review somewhere, amendments, not a review. There was an amendment in 1972. So you see how crime generally has evolved, but one would ask, is the age of the law enough to warrant its review? I dare say no. The age of the law alone is not enough. But if you look at how the law was couched, and how crime seems to have evolved, because this is a law that was to fight crime. And this criminality is also bordered on the changing nature of technology. So, yes, the age of the law alone will not be a justification. If you look at what it's intended to do and the tools and instruments it is supposed to regulate and control, which is changing so fast, then it tells you that the age of the law in this context matters.
Well, touching on the need to reform Ghana's firearm laws, Johnson Asante Chum highlighted the lack of restrictions on the number of guns an individual can own. He called on the Ministry of the Interior to take urgent action and expedite the process for the bill's passage to strengthen firearm control and enhance national security. And he says the lack of proper regulation is causing the state to incur huge losses.
There is a new minister at the Ministry of Interior, and also just hearing that there is a new executive secretary. Of course, he has also been part of civil society activism to get the bill passed. We're hoping that they will expedite action and get this to the attention of cabinets now, and they will work on it. There are obvious benefits for reviewing the arms and ammunition laws. As I mentioned before, in the year 2020, in October, when the EU blacklisted Ghana on the anti-money laundering and terrorism financing issues of having weak legislation along that area, the Ghana Arms and Ammunition laws were one of the concerns that the EU raised, and the ministry then wrote to the commission at the time asking them to bring the bill for them to pass. Unfortunately, when EU lifted the ban, the ministry forgot about the bill, and things went back to normal. We are hoping that at this time, the commission and the new minister for the interior will work on it and expedite action and take it there. And if it is properly regulated, the state could make more money. Not just more money at the expense of the lives of people, but more money whilst protecting the citizenry and protecting, our democracy and our economy.
In other stories, Chief Executive Officer of the Environmental Protection Authority, Professor Nana Brown-Kluche, has issued a strong warning against illegal sand winning at the country's beaches, emphasizing that extracting sand without proper licensing from the EPA is unlawful. She made this statement during a visit to assess the destruction caused by tidal waves in Agaveji, Salekope and Amutuni in the Keta municipality of the Volta region. Professor Kluche stressed that sand winning in Keta, a low-lying area, significantly increases the municipality's vulnerability to coastal erosion and environmental disasters.
EPA regulates all mining activities in the country. So before you mine any place, whether it's sand or gold or stones, you need to have permits from the EPA. So we need to assess those who are winning the sand if they have the permit to do so. As you rightly said, Keta area is already a low-lying area. So winning the sand means giving more way to the sea to take over the communities. These are all illegal activities, and of course we call on all citizens to be alert, and we should correct each other. These activities harm us more, plus the natural disasters that we are seeing. So we have to put a stop to all these illegal activities of winning the sand or mining the sand in the areas as well.
The Minister of Education, Haruna Idrisu, has indicated that the Mahama-led government inherited a sinkhole economy that is in distress and needs to be reset and put back on track. He said it is only when this is done that the government would be able to invest in massive infrastructure development in the education sector to ease the deficit, especially in the second cycle schools. He was speaking at the 72nd anniversary Grand Durbar of the Keta Secondary Technical School in Keta.
The 72nd anniversary of the Keta Senior High Technical School was on the theme Bridging the Generational Gap, Our Legacy and Inspiring the Future. It brought together management, students, old students, stakeholders and citizens of Anglon to celebrate the strides of Keta School. Addressing the Grand Durbar, the headmaster, Innocent Kwame August, made a special appeal for support to set up a modern ICT lab after listing the lack of infrastructure and academic logistics as the main challenges of the school.
I wish to use this opportunity to make a passionate appeal to all hearing gathered towards the setting up of 2 new computer labs for the school.
The Minister of Education, Haruna Idrisu, underscored the government's commitment to improving the country's technological literacy.
The President, your President, will introduce digital literacy beginning from kindergarten and spread it to tertiary level, and make investment in innovation and technological hubs, not only in institutions of technical and secondary education, but also in institutions of higher learning. So the economy, Excellency John Dramani Mahama is inherited. It's a sinkhole economy in distress that needs to be reset and put on track for him to deliver massive infrastructure support to our educational institutions.
The Volta Regional Minister, James Gunu, assured of an effective collaboration with all stakeholders towards the development of the region.
We are committed as the government, as the Regional Coordinating Council, to collaborate with all of you to see to the development agenda of the Volta region.
The guest speaker, the Dean of the University of Cape Coast School of Business, Professor John Gachi, implored the government to invest in enhancing technological education, among others, to bridge the country's generational gap.
Education and training are the best tools to bridge the generational gap occasioned by changes in technology, value systems, policies, and life expectancy.
The 1975, 85, 95, 2000, 2005 and 2015 year badges presented 750 monodecks, a sanitary facility and a wall clock, among others, to the school. Fred Kwame Asari, JoyNews, Qatar.
Away from Keta, Member of Parliament for Lambwisi, Professor Titus Kofi-Beyu, has called on the government to consider opening more PCR diagnostic centers for testing cerebrospinal meningitis. The region for now has one PCR diagnostic machine located at the Upper West Regional Hospital. He noted that if the testing is decentralized, it will help in the fight against the disease if it is detected early. Now, the Upper West region has so far recorded 169 suspected cases of CSM, 27 suspected cases and 16 deaths. Professor Titus Beyu made a statement when he donated medical and non-medical consumables to the Lambwisi Health Directorate for onward distribution to health facilities in the district to help in the fight against meningitis. JoyNews Upper West Regional Correspondent Rafiq Salam tells us more from Lambwisi.
The Upper West region, as at Friday, February 21, has recorded 169 suspected cases of meningitis, 27 confirmed cases with 16 deaths. Out of these figures, the Lambwisi district recorded 11 suspected cases, 2 confirmed cases with 1 death. Lambwisi District Director of Health Services, Jerry Binu, deeply concerned about the rise in suspected cases of the disease, made appeal to benevolent organizations and individuals to come to the aid of the district for them to be able to improve the case management of the disease in the district. Member of Parliament for Lambwisi, Professor Titus Kofi-Beyu, responded to their call and donated medical and non-medical consumables valued at 55,000 Ghana cedis. Items donated included 100 pieces of spinal needles, antibiotics such as ceftriaxone, 40 pieces of thermometer guns, and 8,000 pieces of face masks.
Professor Titus Beyu therefore used the opportunity to call on the people to have a behavioral change to help fight the disease.
Let me also use this opportunity to appeal to our traditional leaders, our elders, that some of our practices must change around this time. When we have an outbreak like this, it calls for a change in behavior. The burial of the dead, how we organize our funerals, and people absconding from hospitals when a diagnosis has been made will not help us. This is a disease that is contagious. It can move from one person to the other. And so we need to take the advice of the health service around this time.
He urged the people to quickly seek medical treatment at the various health facilities, adding that treatment for the disease is free.
If you have a patient that gets to the hospital and unfortunately passes on and they suspect this is it, please allow the health system to do what they are supposed to do. If they suspect the diagnosis, they need time to take a sample, please, let's do that. I'm also aware that the treatment has been declared free. So no one with the symptoms should stay at home. And to state that the current variant we are dealing with is quite fatal, it's quite virulent. It doesn't waste time in clearing its victims. So it means that when you get it, or you have the symptoms, don't sit at home. Get to hospital. They have their facilities. We have given them support to be able to treat you so you can be treated.
Professor Beyu calls for the opening of more PCR diagnostic centers to improve the capacity of the region in managing the disease.
The region itself, we need to improve the capacity of the region. And by this, I'm appealing to the government and all other stakeholders. The PCR diagnosis can only be done in the regional capital. It means that if you take samples here, you have to send to WA before you can make that diagnosis. I think that this can be decentralized if we can get the capacity.
Lamuse District Director of Health Services, J.D.B. Nuhu, whilst thanking Professor Tatius Bayu for his kind gesture, pledged to make judicious use of the items donated.
These items that I have received today will be distributed to almost all the health facilities across the district, and much of them will be sent to the case management centers, Lamuse Polyclinic and then the Hamel Polyclinic, where most of our cases are managed there. I want to assure Honorable Professor that the meningitis situation will be brought to control.
The Lamuse legislature made a whistle-stop visit to Lamuse Polyclinic, where he interacted with staff of the facility. Whilst at the polyclinic, he paid a visit to a middle-aged lactating mother who was brought to the facility suspected to have contracted meningitis.
We did the lumbar puncture for her. We sent the sample to Nandom for the screening, where we started the treatment as is indicated. Once we suspect, we need to take sample, then we'll start treatment while waiting for our results. So we've taken the sample, and also, coincidentally, she has malaria in addition. So we are treating the malaria, hoping that by today or hopefully by tomorrow, we'll get our results in, and then we'll know what we'll do next.
Medical Superintendent of the Lamuse Polyclinic, Dr. Charles Wonga Bayel, conducted him round the facility.
We need to protect ourselves. This is the period where we should use the nose mask. Nose mask was not only for the COVID-19 period, but also it prevents the transmission of this meningitis we're talking about. It's through droplet infection. So the use of nose masks is one single intervention that would help us.
Reporting for JoyNews, Rafik Salam, Lamuse.
Director General of the Ghana Health Service, Professor Samuel Kaba-Korea, has called for a robust AI framework to regulate its integration into the country's healthcare system. Health experts have long advocated for AI adoption to enhance accuracy and efficiency in service delivery. Speaking at a workshop on AI diagnosis and treatment standards in Accra, Professor Korea stressed the urgency of a regulatory framework to guide AI-driven healthcare. There's more in the following report.
Held under the theme Advancing AI Diagnosis and Treatment, Building a Framework for Healthcare Transformation, the one-day workshop by the Health Community for West Africa, HECOA, brought together healthcare practitioners from across the country and the sub-region. The event focused on developing a framework for integrating AI into healthcare. Speaking at the opening, the Director General of the Ghana Health Service, Dr. Samuel Kaba-Korea, emphasized AI's transformative potential and underscored the urgent need for a regulatory framework to guide its implementation.
AI is not just about technology, it is about transformational tools that, when used reasonably, can improve lives. But it requires a collaborative effort. Government, private sector, innovators, healthcare professionals, and regulatory bodies must work together to develop robust AI regulations that balance innovations and security. We must ensure AI tools meet Ghana healthcare standards before deployment and empower healthcare workers with AI training and oversight mechanisms. Colleagues, AI will not replace doctors, nurses, or healthcare professionals, but those who use AI effectively and responsibly will lead the future of healthcare.
HECOA Vice President Prince Dogbe stated that the AI in Healthcare initiative aims to expand across Africa to improve healthcare across the continent.
HECOA Association is Health Community of West Africa, so we are not being limited to only Ghana. We are cutting across borders. We also have Guinea, we have La Côte d'Ivoire, and we have Togo. These three countries are partners to us, and we are hoping that we can cut across all the 16 countries within the West African sub-region. And then also in the future, also cut across the 54 countries in the African continent.
A Russian-trained medical doctor, Paulina Mafia-Dente, highlighted how an AI-driven diagnosis and treatment system can assist cross-border travelers during medical emergencies.
If let's take it as somebody is very sick and the person find him or herself in a different country, one of these African countries, and they need maybe any agent kind of information or details. Let's take it even in a case whereby the person can't speak, maybe a speech problem, they will be able to access through the internet, through this AI diagnosis, and then things will be very fast and easy. And diagnosis can be put for such a patient, and that patient will get help from the medical facility that he or she find themselves.
On his part, Dr. Emmanuel Kwakumi of the Private Health Facilities Association urged policymakers to take immediate action in developing regulatory framework for AI in healthcare.
I believe based on this AI policy framework, we are way behind because globally, the world is going forward. I think we may be about 15 to 20 years behind. So they should embrace it. I believe we have a lot of frameworks there already. Others have engaged in these things. So it's just about time that we all embrace it, all hands on deck, and make sure that this is the new era.
Participants assert that an AI-driven diagnosis and treatment system could bridge the country's doctor-to-patient gap. For Joy News, Carlos Caloni, Accra.
Moving on, illicit drug use in Ghana has surged significantly over the decades, driven by factors such as unemployment, economic hardship, easy access, and peer pressure. Despite the country's strict drug policies, illegal substances remain widely available. A study conducted by Peter Amadu and his colleagues from the Department of Mental Health at the University for Development Studies reveals that 58.4% of youth aged 12 to 18 in the northern region have used drugs at least once. In this report, we meet 20-year-old Abdul Waris, once a vibrant young breadwinner for his family, whose life took a devastating turn due to drug addiction. His story reflects the struggles of thousands of young people across the northern region now battling substance abuse. Enjoy.
I'm a fella to Tuntuma, Shaku Valley. The Kong weekland, can't be Cora. I could talk to Tumba, how young, I'm a fella to do. She could disturb her.
In this city, various camps where drug addicts seek solace are fast emerging. We gain access to this camp inside Abuabo Forest. Most of the users say joblessness pushed them into drugs. The drug menace compels citizen action. At this forum, organized in Tamale in August 2024, a traditional ruler of the Dagbon community in North America, Na Basha Ibrahim Idrisu, engages stakeholders on how to address the menace.
We actually have a serious crisis in Dagbon. And this goes to all politicians. It doesn't matter which political party you are. It is high time, even if government is supposed to declare that as a national or as a regional crisis, they have to seriously. We are in a serious problem. And if we don't take time, for the next 5 years, the thing will be uncontrollable.
Ghettos, just like the forest, have become hubs for drug users. Today, the chief is engaging addicts in this ghetto at Lamashegu. One of the substance users is Barakesu. a secondary school dropout now doing drugs. Diamana had a revealing dialogue with her.
How did you end up here? Because American am akonya pa.
Gaisia ukonaji.
Inirwala nyenya.
1,000.
1,000? Really? Barki sumbutana 1,000 nyenya.
The gaisia.
Am I be pa 1,000?
Nabwa chief. She's really shapia.
Shapchi me.
So want to mana para now.
Mulechi.
French shaba.
Bayule. Yalama, don't worry, Yalama. A friend Banama. Eh?
Radia
Chia. Zakia Chia. Muna Chia.
Oh,
calma. Calma, Kubane. Shab you a falan one. Wow, Fondan Kabi.
Base Sanarugo.
Sanarugo Yildene.
Mother yelling.
Kupalma, Sanaro
Yilma, because come father's side, come father. Young come mother.
So I'm very young.
And jealous. But sometimes can sense.
I'm a boyfriend. Yapolo Kobi. Or Jilaki.
Be on a car round.
On a car round. So I'm in Biara.
Upper West Regional Health Director Dr. Damien Pungiri warns of rising antimicrobial misuse, linking it to 60% of drug-induced kidney injuries in hospitals. He urges rational antibiotic use to curb resistance, enhance drug effectiveness, and improve patient outcomes. He made the call at the Upper West Regional Hospital's annual review, and JoyNews' Rafiq Salam reports.
The annual review meeting by the Upper West Regional Hospital was held on the theme Rationalizing Antimicrobial Utilization in the Upper West Regional Hospital, the role of antimicrobial stewardship. Upper West Regional Director of Health Services, Dr. Damien Pungiri, asserted that considering the steep rise and abuse and misuse of antimicrobial in the region and the country at large, he saw the team chosen as apt and timeous.
Research has proven that drug-induced nephrotoxicity accounts for up to 60% of cases of acute kidney injury in hospitalized patients and is associated with increased morbidity and mortality in both adults and children.
Dr. Damien Pungiri emphasized that there is therefore an urgent need for a concerted and sustained efforts if the abuse of antibiotics in the region is to be quelled.
This hospital, which is a repository of healthcare delivery in the region, must ramp up its efforts and design niche strategies to tame the abuse of antibiotics in the region by establishing a regional surveillance system, educating both healthcare providers and patients.
Medical Director of the Upper West Regional Hospital, Dr. Robert Amesiye, threw further light on the annual review meeting.
The last month of last year, the National Health Insurance absorbed dialysis as one of the packages that they are going to pay for. We need to find out the astronomical increase in the uptake of dialysis services and how we are going to cope with that.
Reporting for JoyNews, Rafiq Salam. Wow.
And that does it for Newsroom with me, Sweetie Abochi. For more news, log on to myjoyonline.com to keep you updated. But please stay for the law with Samson Ladia Yenene. Bye for now.